Good morning, my dear students. Hello, everyone. How are you today? So, today is Tuesday, the 14th of December 2021. So, our first subject, or no, second subject for today is health. Okay, so we're going to talk about COVID-19 and dengue. Are you ready? Okay, we're going to talk about COVID-19 and dengue. Okay, so here, COVID-19. COVID-19 go away, never come back on our way. Little children wants to play. COVID-19 go away. COVID-19, please go away. We don't want you anymore. Okay, COVID-19. What is it? How can we stay safe and work together to beat it? Okay, we don't like COVID-19, right? Okay, so introducing Hans. Hello, my name is Hans. I would love to shake your hand, give you a high five or a fist bump, but right now we can't do that. Have a read of this handy guide I have put together to help you understand why life is different from us all at the moment. Okay, so this is Hans. The name of this one is Hans. What is COVID-19? COVID-19 is the name of a disease which is causing a lot of problems around the world. The virus has spread because infected people move all over the world, not knowing they had it. COVID-19 is part of a group of viruses that all have the same shape. This group of viruses are a type of virus known as coronavirus. Okay, the virus itself is incredibly small and can only be seen with a very powerful microscope. However, it can get into the human body, and if this happens, it can make the person who has it feel unwell. Okay, so it cannot be seen by our eyes. So we need to use this one microscope. Okay, how does the virus get into the human body? How does the virus get into the human body? When someone who has the virus coughs or sneezes, the virus can be forced out into the air and on the people and nearby surfaces. The virus can live on human hand and enter the body if a person touches their face, puts their fingers in their mouth, and eats something without washing their hands. The virus can stay on different surfaces and can then be transferred to people when they touch those surfaces. Okay, how does the virus affect people? How does the virus affect people? Once the virus gets into the human body, it stays in the lungs. It may stay there for a few days or weeks without the person knowing they have it. However, it eventually makes people feel unwell. They might start with cough and have a fever, high temperature. So You know what is high temperature already, right? So if the person is infected with virus, coronavirus, he he will feel, or the people will feel, unwell, and they might start with cough and have a fever or high temperature. The virus affects different people in different ways. Some people will get better on their own, others will need to go to the hospital. Children do not appear to get very ill if they catch the virus, but older people and those who are already ill can become very unwell. Okay? So children do not appear to get very ill. Okay? Because they're still children. Their immune system is still good. But for the older people, okay, so older people and those who are already ill can become very unwell. So COVID is prone to older people. Okay, so next, what have we learned about COVID-19? What have we learned about COVID-19? Okay, COVID-19 is a form of coronavirus and it is so small that we can only see it with very powerful microscopes, not our eyes. So we cannot see, look at this picture. We cannot see this one in our eyes. See may? We need to use microscope. The virus can enter the human body and infect the lungs. Okay, we use our lungs to breathe, right? We use our lungs to breathe. So it can give people a fever and or cough that does not go away. The virus can enter the human body through the air and can live on the surface and people's hand. So remember, COVID can live in our hands. So make sure that we are washing our hands every now and then. How can we stay safe and work together to beat COVID-19? Okay, how? How can we stay safe and work together to beat COVID-19? As people can have the virus in their body without feeling ill, it can be spread without people releasing. Doctors, nurses, and all hospital staff are working hard to look after the people who are feeling very unwell after catching the virus. It is important that not too many people become very unwell at the same time, so the people who need to go to the hospital get a bed to sleep in and treatment they need. So doctors and nurses are very helpful nowadays, right? Okay, they take good care of the people who get sick. We need to all work together to stop it spreading and making people ill, especially older people and those who are already unwell with another condition. Okay, so we need to help each other, right? We need to work together to stop spreading the virus. Okay, the way to stop it spreading is by limiting the amount of people we are near. This is the reason why school have closed, why many parents and carriers are working from home at the moment, and why we have all been asked to stay at home if possible. Okay, so what we are doing now, we're staying at home, right? We're learning from home. We're working from home. So this uh this will help. This will help to limit spreading the virus. Okay? How can we stay safe? Work together to beat COVID-19. Stay at home. Okay? Stay at home. Only leave your home to buy food, get medicine, and to exercise once a day. It's very important to exercise. Okay, next. If you must go out, stay more than 2 meters away from the people who do not live with who you do not live with. Okay, stay away from people at least 2 meters away. Next, if someone is unwell with a high temperature or a new continuous cough, do not touch them or go near them. Okay? Do not use public transport unless it is essential that you do. Okay? Do not use public transport unless it is essential that you do. Grown-ups should work from home if they can. Okay? Grown-ups should work at home or should work from home if they can. So what we are doing now is work from home. We're learning from home. Okay, look at the picture. Do not get together with people who do not live with you in public spaces such as parks or on the street. Next picture. Do not meet up with friends or family who you do not live with. Okay? Do not meet up with friends or family who you do not live with. And keep in touch with family and friends by using phones and internet. Use the phone to contact people who help you stay safe and well, such as doctors. How will we beat COVID-19? By not being near too many people and not going to school or work if possible. Doctors, nurses, and all hospital staff are helping those who are very ill. Follow the advice and stay at home. Stay at home. Okay, the easiest way for the virus to get into the human body is on people's hand. So, it is important to wash our hands often for at least 20 seconds. We can also remind people we live with to wash their hands too, especially before eating. Okay? Whenever you go, wherever you go, whatever you do, wash your hands, especially before eating. Okay? Coughing and sneezing, achoo, can spread the virus on our hands and to other people around us. When we cough and sneeze, we must cover our mouth with a tissue or our elbow. Okay? Don't forget, if you cough or sneeze, achoo, cover your mouth with tissue or your elbow. If you don't have any tissue, you can cover with your elbow. We must not cough or sneeze into our hands as we could spread the virus very easily to all the things we touch. If we use a tissue, we must throw it away immediately, then wash our hands. Okay. If someone we live with becomes ill with a fever or a cough, we must all stay at home for 14 days or 2 weeks. We must not go too close to anyone who is ill, at least 2 meters away, and not share anything that we touches our face. Anything that touches our face, like fork or cups. Okay, how can we all help? How can we all help? Wash our hands often and remind everyone to do the same. Keep a safe distance away from other people. Cough and sneeze into our elbow, and if anyone we live with is ill, do not share things with them that touch our faces. Okay, hands up. Who is ready to work together to beat COVID-19? Remember, if you have any worries or questions about COVID-19, talking to an adult you trust is a great place to start. And that's it about COVID-19. Okay, let's watch this video about dengue, COVID-19, and influenza.
Experiences headaches, body pains, nausea, and vomiting. When a person has a fever, experiences headaches, body pains, nausea, and vomiting, it's possible they have dengue, but it's also possible that they have the flu or even coronavirus. So how are you supposed to know which is which? Here's a guide on the differences between dengue and other viral infections. Dengue mainly comes from infected mosquitoes. Symptoms include fever, headaches with eye pain, nausea, vomiting, rashes. It usually takes 3 to 10 days for symptoms to appear after one gets bitten by an infected mosquito. Someone with severe dengue shows the following warning signs: abdominal pain and tenderness, frequent vomiting, mucosal bleeding or vomiting blood, restlessness. COVID-19, or the coronavirus, is caused by the virus SARS-CoV-2 and mainly transmitted from person to person. Someone with COVID-19 may show these symptoms: fever, cough, fatigue, diarrhea, sore throat, headaches, runny nose, nausea, vomiting, shortness of breath. These symptoms often start mild and develop gradually, taking 2 to 14 days for symptoms to show. It is also possible to be asymptomatic, which means you don't show symptoms but are still carrying the virus and could infect others. Then there's the Zika virus, another disease that comes from mosquito bites. Someone with this disease may exhibit the following symptoms: rash, fever, joint pain, headache, muscle pain, conjunctivitis, red eyes. It usually takes 2 to 12 days for symptoms to show. The flu, on the other hand, is an infectious disease caused by the influenza virus, usually transmitted by respiratory droplets. Its symptoms include cough, fatigue, sore throat, runny or stuffy nose, headaches, and body aches. A person with the flu may also have a fever, but not everyone with the flu will have this. It usually takes 1 to 4 days for symptoms to begin after exposure. Bronchitis is another common respiratory infection that affects the main airways of a person's lungs and can also be transmitted from person to person via respiratory droplets. Bronchitis symptoms include low fever, wheezing, sore throat, persistent coughing, blocked nose and sinuses, headaches, and body aches. It may show between 4 to 6 days after infection. Getting the right diagnosis will determine the best treatment for you. If you're experiencing any of these, call your doctor to undergo the right diagnostic test. Being proactive about your health, especially when you're experiencing symptoms, can make a big difference towards recovery. Stay informed and don't be afraid to seek professional medical help to avoid a misdiagnosis and possibly the wrong treatment.
Okay, and that's it for the video. Okay, so that's our lesson for today in health subject. See you next time. Bye bye.